Okay, topic today is I want to talk to you about the symptoms. This is something Dr. Schröder will tell us more about. I want to tell us something about inflammation. I want to talk about the MELISA technique. And there are some statistics and case studies about chronic fatigue, about fibromyalgia, and about autoimmunity. Prior to all testing, patients get some questionnaire, and this questionnaire is evaluated by us, by Linda, by Julia, by Jana, and by me. And part of this questionnaire are the symptoms. And the symptoms we read are very multisystemic. They are sometimes diffuse. So you read something about joint pain, you read something about skin rashes, muscle pain, chronic fatigue is always a topic. And you can't really get a grip. You can't find the source, the trigger for these symptoms. And most of the times, the treatment of these different symptoms is more palliative, meaning you treat the symptoms. You just put on ibuprofen on headache, you put diclofenac on joint pain. And this is what Dr. Genius, he stated at Atlanta University, claimed is rising prevalence of patients who's present with a list of ongoing, seemingly unrelated, persistent complaints often include, and this is what we read every day in our questionnaires, is headache, joint pain, fatigue, brain fog, bloating, chemical intolerance, muscle aches, itchy skin, and a lot of more. And even CDC stated it was in 2000, virtually all human diseases result from interaction of genetic susceptibility and modifiable environmental factors, modifiable. This was just a quick glance about the symptoms, and let's get into inflammation. This is a broad sketch of the immune system, of the cellular immune system, and what I wanted to point out is it is hard to isolate a single cell type and to detect on this cell type and to make experience on this cell type. There is a lot of crosstalk. Different cells of the immune systems, T cells, B cells, NK cells, which I didn't mention in this slide, macrophages, of course, do have crosstalk. They communicate. This is done by cytokines, and this is done directly between the different cells. And very important part is, even if we deal with T cells in the MELISA, we also have monitoring of the macrophages and of the monocytes. And there are doctors in Germany claiming that you can't do a titanium test on lymphocytes, which is wrong because of this. You simply have the crosstalk between the monophages, and the T cells. To get the relevance of inflammation, this is from 2004. And Time magazine gave it the front page, 2004, inflammation, the secret killer. Okay, inflammation. We at the beginning of our laboratory, we focused on metals only. There were only some very few antigens present, which are not on metallic base. And this is where I try to point out with this slide is that we have a lot of sources of exposure for metals. Okay, and so it comes down, 2008, on the website, the US, the famous FDA put out a warning: if you're allergic to any of the metals in dental amalgam, you should not get amalgam fillings. How surprising, 2008. Further, if you believe you have an allergy or sensitivity to mercury or any other metal in dental amalgam, such as silver, tin, or copper, you should discuss treatment options with your dentist. 2008. The first cases of metal hypersensitivity were published in the 90s, in the 70s, late 70s. So in 2008, FDA says, if you may be allergic, so you should avoid. Okay. What are we dealing with? When we talk about allergy, there are 4 different types of allergy. It's type 1 allergy is that what everyone combines with the word allergy. It's the immediate type, it's IgE mediated, it's an antibody. It's a direct type. If the patient, for me, it's getting dust mites, for example, if I get in contact with dust mites, I get immediately symptoms. Type E mediated. Type 2 is IgG mediated. It's a little bit slower than the immediate type, and most of the applications are for food stuff, for example. Type 3 is something about immune complexes without any significance in clinical diagnostics, as far as I relate. And we are talking about type 4 allergy. Type 4 allergy has nothing to do with the humoral immune system. It's not antibody mediated, it's T-cell mediated. And by this, it's called delayed type hypersensitivity, meaning it can take days to weeks for the symptoms to occur. They are mediated TH1 cells, by the way, and the story behind is that metals are haptens. They are too small to be recognized by the immune system, especially by the cellular immune systems. But what happens is that these metals bind to proteins and enzymes in the body. And by this, they alter the three-dimensional structure of these proteins. And by this, the proteins are recognized by the own immune system. So it's a direct development of autoimmune diseases. What we are not dealing with MELISA is toxicity. So we are looking for immunological reaction. We are not looking for high levels of, e.g., mercury or other metals. And the patients we are dealing with have absolutely normal concentrations of the given toxin in their blood, in their urine, in other body fluids. We can measure in the hairs. But nevertheless, they have a systemic reaction to these, which is provoked by the immune system. And this is absolutely independent from the concentration of the amalgam or of the other toxins. And it's dependent on the individual susceptibility. So remember, CDC saying it's genetic susceptibility. I call it individual susceptibility and modifiable environmental factors. We can put out the amalgam. Okay, let's come to the MELISA test. MELISA test means memory lymphocyte immunostimulation assay, and nomen est omen. What we do in the lab is, first of all, we withdraw the blood, and we need a lot of blood. It's for testing on a panel of, let's say, 20 metals, we need 6 of these 9 ml tubes, 56 milliliters of blood. Patients are not used to so high volumes of blood. Never mind. So what we do is we do a so-called Beckord pack. We isolate the lymphocytes. And what you see, I'm not sure if it's displayed. What you see there is a white layer. And these are the so-called PBMCs, peripheral blood mononuclear cells. And most of them are lymphocytes, but there are also monocytes, and the monocytes would disturb the test. We need really a few of these monocytes as antigen-presenting cells, but higher amounts would simply disturb the test and lead to unspecific results. So we do a cleanup of monocytes. We do a depletion. Still, some monocytes left, and after this, we set up a specified concentration of lymphocytes, and we incubate them with and without antigen for 5 days under CO2. We do a positive control, which is done by pokewheat mitogen, which simply shows if the lymphocytes of the patient are reactive, more or less. We do a negative control just to monitor the basal proliferation of these lymphocytes. And of course, we do lymphocytes together with the metals of interest. And after 5 days, We do so-called pulsing, meaning we add some radioactive thymidine, and after short incubation, harvesting is done. And after this, there is a beta counting done. Beta counting means the more reactivity we measure in one of these wells you saw at the plate, the more proliferation happened, and the more the immune system was triggered to fight against these antigen. And specialty of the MELISA is that we do a second step, a second confirmation step, a second evaluation step by morphology, looking through the microscope if it really was the lymphocytes and the lymphoblasts reacting, or if it was the macrophages, for example. And this is what we see. Great picture, thanks to Liz Valentine-Tome. What you see there are the lymphocytes. And these are the only cells we see in a negative reaction. But what we also see in the positive results are these blasts, these lymphoblasts. And this indicates simply a positive reaction to the antigen we monitored. And as I mentioned, there are still some macrophages we need as antigen-presenting cells. And funny enough, you see a dividing lymphoblast. So this is proliferation. Lymphoblasts, growth of the cells, and dividing of the lymphoblasts. Okay. After evaluation, there comes a report. So this is an example report. We give the quantitative results as a table. We also give the quantitative results as in some graphics. There is an explanation about the test. What do my results mean? What is an SI index? And we give explanations for every single metal or antigen we tested. So a report about 20 metals may have 20 pages. And it's created for the patient to understand. Of course, there are alternatives. There are patch testings, and there are other LTTs, lymphocyte transformation tests. MELISA is an optimized and an improved LTT. So let's get to the patient test. Location. I guess it's clearly known that an implant inside the skin where the patch test is done and an implant inside the jawbone or inside the knee is a different story. You got different cells, type of immune cells, and you got different reactions. So MELISA does test inside the patient's blood, the individual patient's blood. We are not itching the skin. The subjectivity. With the patch test, you have red rushes. I will show a picture later. And you have to distinguish if it's a weak positive reaction, a positive reaction, strong positive reaction by the intensity of the rush and by the size of the rush, and if there are eczema or no eczema. Sensitization. The MELISA is done in vitro. Patch testing is done in vivo, inside the patient, on the patient. And there are some articles about triggering the sensitivation of the patient by the patch test. So because you do it on the body. And suitability, very clear. US-based Mayo clinic, I guess I don't have to tell you about Mayo, failed to find any positive reaction of titanium in over a decade of patch testing, more than 1,000 patients. So patch testing is not suitable for titanium allergy or titanium hypersensitivity. This was published in 2011. And these are the difference. You see patch testing, the skin is itched, some metal salts are applied, and after some days you get these rushes, you get this eczema, and you have to distinguish, is it positive, strongly positive, weakly positive. And this is an LTT with the MELISA. As I already mentioned before, oops, sorry. Here we are, sorry. As I already mentioned, negative response, only lymphocytes are present. Positive response, we got cell growth and division and lymphoblasts, and we got proliferation. And this proliferation can be determined quantitatively and very, very reproducible. Okay, other LTTs, as I already mentioned, MELISA is an LTT, an optimized and improved LTT. It is the worldwide only standardized LTT, and it's testing for a wide range of metals. This is one of the main critic points in Germany. Mainstream medicine has some problems with the evaluation of the LTTs because they claim it's not standardized, and they are right, because my own old laboratory in Cologne also performed an LTT, and it was of, let's call it, questionable quality. So nearly every second laboratory in Germany is performing some LTT, but they are not comparable, the results, and they are not standardized. So MELISA is standardized worldwide. MELISA uses many more cells, and this is the reason why we have to get so much blood from the patient. We need up to 1 million cells per concentration, per well, per antigen. And this is not done by normal LTTs with a factor of 10 or even 100 lower. We do not use monocytes. This is what I told you before, is we try to get rid of these monocytes because they may disturb the test. This is not done by normal LTTs. We have developed non-toxic, non-mitogenic metal concentration. This is a hard job because if the concentration is too high, we have toxic in vitro effects. If the concentration is too low, we don't have any sensitivity. And especially with mercury, it's a story that the concentration a little higher used than in MELISA, it works mitogenic, meaning it provokes proliferation unspecifically. And we have an additional layer of accuracy, and this is the morphological control. This is not done by a normal LTT. And it's been used, of course, by many independent research institutes, and the results have been published widely.